the main culprit sometimes can be grandparents.
Bagi je apa dia nak.
Yes, exactly, sayang.
Nak sweets, bagi. Nak cupcakes, nak lagi cupcake, nak chocolate ice cream.
Exactly.
Specialist Centre isn't your typical hospital. It's Malaysia's premier quaternary hospital where rare, complex and next-level care comes to life. This is Quaternary Care, where our team of trusted super consultants are here to take on your toughest health battles using advanced technology and research-backed treatments all under one roof. Now, back to Nadia Azmi for UMSC's Curated podcast.
Hi everyone, this is Curated, brought to you by Specialist Centre or UMSC. I'm Nadia Azmi, and today we have a very interesting topic, especially for parents out there, whether you're a parent, a caregiver, an auntie or an uncle, because it's going to be about kids and sugar. Everywhere we look, birthday cakes, cupcakes, boba tea, sugar is everywhere. But all these sweet cravings of our children, when should we be concerned? So today we have a very lovely guest in the studio, an expert that we really need to talk about and to unpack the dangers of sugar. We have in the studio Associate Professor Dr. Azriyanti Anuar Zaini, a consultant pediatric endocrinologist of UMSC, to help us decode the difference between a sugar rush, we always hear that, right, Prof?
Right.
And a real red flag. So welcome, first of all, to Curated, Prof.
Thank you, Nadia.
Are you excited?
Very.
To talk about sugar.
Yes.
It's something that we all love, especially as Malaysians. I think whether you're a child, an adult, it's hard to resist. It's everywhere in our foods and drinks, and
Correct.
it tastes so good.
Yep.
But today we're going to talk about kids.
That's right.
That's your area of specialty. We know that children under the age of 12, for any health issues, they would see, of course, a pediatrician.
Okay.
That's the doctor,
Correct.
right?
That's right.
But you are a pediatric endocrinologist. It's quite a mouthful to say. What does one do when you are a pediatric endocrinologist? When do parents need to send their children to see one?
To see me.
Yeah.
All right. Okay, thank you so much, Nadia, for the introduction. And hello, everyone. So we're going to talk about pediatric endocrine.
That's right.
So do you know that there's not many of us here in Malaysia?
How many exactly?
30.
30 sahaja
Sahaja.
yang mempunyai this kind of kepakaran
Correct.
dalam satu Malaysia.
That's right. So you probably
You are a
have
gem,
heard,
not Prof.
Exactly. You've probably have heard adult endocrine. So the ones that manages diabetes in adult.
Okay.
Orang yang sakit apa kita panggil diabetes, kencing manis
Yeah.
for adults is managed by the adult endocrine. We have a lot of adult endocrine in Malaysia.
Okay.
But pediatric endocrine, so pediatric endocrine is doktor pakar hormon kanak-kanak. So only 33 of us in Malaysia, and that's we are quite a rarity lah here.
Okay,
In Malaysia,
and we know that this is a problem prevalent among kids. Saban tahun, the issue of diabetes
Correct.
is getting more and more prevalent. The number of cases are increasing among kids.
Yep.
So the more the need for us to have specialists and experts like you.
Definitely.
Yeah. But then what kind of patients do you usually see? Yes, they're all kids under 12. But if you can elaborate a little bit, what kind of patients that you see on a daily basis?
Sure, definitely. So you're saying just now pasal general pediatrics.
Yeah.
Okay, so pakar kanak-kanak. Saya pakar kanak-kanak endocrine. So dah sub-specialized dekat situ. So we are very quaternary care lah kita panggil, quaternary care. And you can find me in UMSC. So I cater or I see patients particularly either they are too thin,
Too thin, kurus sangat
Too
pun
fat.
menjadi satu masalah.
Satu masalah.
Walaupun itu menjadi impian ramai orang.
not in children.
Okay, yeah.
Too fat.
Okay.
Okay. Too tall and too short.
So they have like a threshold. Is there like some kind of measurement,
Yes,
a
definitely.
standard measurement that you will be guided by?
Definitely. And of course, I've got lots of my friends out there who are general pediatrician, pakar kanak-kanak yang lain, yang boleh kenal pasti masalah yang they know that they cannot cope atau they cannot handle, so therefore dia akan refer pada kita lah.
Okay.
Sebab it's beyond the normal atau beyond the easy things yang they can actually manage as a general pediatrician. So they definitely akan hantar pada saya.
But when you meet these parents that bring in their children to your clinic, kan,
Correct.
most of the time, is it a kind of too late? Parents mungkin sometimes they're in denial or they did not detect a problem with their kids.
Correct.
And then they come to you when it's a bit too late.
Yes, okay. So there are a few different types of parents yang datang jumpa saya. 50% of them comes from a referral daripada my friends out there. Yeah. So general pediatricians akan refer, Dr. Yanti, please help to see this patient. Sama ada obese ke, atau this one probably ada diabetes ke, atau this one terbantut ke dan sebagainya. But there are also 50% of parents who are, to me, I think I'm amazed with their insight as well as awareness that they rasa something is not quite right with my child. So dia terus cari kita. And majority of the time I really take note on them and I listen to them, because the first things first, red flag, kita panggil red flag, is when parents are concerned. So kalau you rasa anak you something's not quite right, please jumpa je doktor.
Betul. Jangan takut, jangan fikir bukan-bukan.
Yes, that's right.
But that's the first step.
Correct.
In order for us to know exactly ada masalah ke tidak.
Betul.
Kalau dekat ASEAN region, Prof, we know that Malaysia sebenarnya number 1 in the ASEAN region for obesity.
Malaysia boleh.
Ouch. Not
Malaysia
a good piece
kan
of
boleh.
data. Malaysia boleh.
That's right.
And then unfortunately, this is becoming more common among children, macam kita sebut tadi lah.
Betul.
Why can't they just see general pediatricians?
Okay, so I'm not saying that children who are obese tak boleh jumpa pakar kanak-kanak. I think that's the first step that you need to do. Go and see the pakar kanak-kanak first. Alright? And 70 to 90% of them is because of poor nutrition. Okay? Salah makan and everything. So at that point of time, the general pediatrician can actually help a little bit, can advise you a little bit and what so not. However, bila dah sampai satu tahap kronik, satu. Number 2, bila dah ada masalah perubatan, then they have to refer these cases to me.
Okay. Kalau Prof, among adults untuk dewasa, there is weight loss medications for adults yang menghidap diabetes.
Correct.
To help them stabilize, is it?
Yes,
their
that's
weight.
right.
Can children be treated with this kind of a similar kind of medication?
So that's why I'm here.
Okay. Yes.
That's why I'm here in UMSC as well.
Yeah.
Correct. Because ubat untuk menguruskan badan untuk adults, like you and me, you definitely not you. Oh my goodness. Like, for example, like me, if I needed to take a medication to help me lose some weight, it is actually quite easily feasible, and you can see a lot of doctors, really, not particularly obese doctors lah, or doctors yang jaga obesity in adult. But in children, ubat yang kita nak keluarkan untuk masalah obesity dalam kanak-kanak ni very niche. Hanya pakar kanak-kanak endokrin saja boleh sign off. Okay. So unfortunately in Malaysia we only have 2 saja medicine yang boleh bantu untuk mengurangkan berat badan.
2 jenis ubat.
2 jenis ubat saja.
Mengurangkan berat badan. Okay.
So of course we talk about preventive measures, lifestyle modification, diet modification, of course kena sihat dan sebagainya. But when it comes where dia dah ada komplikasi, of course atau BMI dia macam skyrocket ke atas tu, of course pharmacotherapy is something that we need to consider. And now even in the international guidelines also are talking about early intervention. Maknanya kalau perlu start ubat awal, let's do it.
On the surface, if we say kids have diabetes or obesity, kita tahu dia ni gemuk, very overweight. But when you say komplikasi, what exactly does that entail?
So obesity adalah masalah nutrisi kan, kita katakan. Okay, bila ada komplikasi tu maknanya dah ada diabetes. Diabetes tu means is already komplikasi. Darah tinggi.
Darah tinggi among kids?
Yes, we have a lot. Especially when they are so obese, they are definitely blood pressure tinggi. You bayangkan tangki yang besar, you nak pump tangki tu, nak make sure air keluar dekat saluran pipe tu, of course you need a stronger pump. So stronger pump means your blood pressure starts to rise lah.
I see.
Jadi I always tell them like that lah. Senang seperti bagi tahu dia orang. Kalau lagi besar the tangki, lagi besar the pump that we need. Okay. So yes.
So let's say a child, dia belum lagi diagnosed dengan diabetes, but he or she is obese,
right?
Overweight. So can children who are obese develop early onset of diabetes?
Definitely.
Yeah.
I've got the youngest, let's see, 10 years old with diabetes. Very unfortunate.
Yeah.
And I've got, I think, actually today not yesterday, I've got a child who is only 5 years old, and she is so obese that I think she'll get diabetes in the next 1 or 2 years. If nothing is done. But
So, Prof, kadang saya
boleh
tengok
berlaku lah maknanya.
It happens.
It happens.
But sometimes unfortunately lah, society mungkin awareness is not there or education is not there. Sometimes kita tengok especially kanak-kanak kecil, toddlers who are very chubby, overweight,
Comel.
they are considered to be very comel, geram, very
Prosperous.
cute, prosperous. So I think we need to stop normalizing that kind of mentality.
Correct.
And memanglah cute, memang cute, tetapi
Yes.
there might be underlying medical conditions.
Correct. And
to
komplikasi.
that. And komplikasi.
Correct.
Oh my.
Stop like you said lah, stop normalizing obesity in children. I mean, adult you rasa seronok being chubby atau you don't like people to say please don't body shame me kind of thing. That's a different perspective completely. But when we talk about children, please protect them. Please protect them from being more obese than they are today. 1 in 3 of our children are either overweight or obese. Sedih. Boleh pergi sekolah mendengar tu kan, I was like, oh my goodness.
The
Tak
food,
mainnya.
it's the food. Is that the main culprit?
Correct.
Food and the
Sedentary.
drinks that's available.
Sedentary lifestyle and the normalization of eating sweets. You were talking about birthday cakes. During that time,
Sometimes every
birthdays,
month ada je birthday.
Correct. And then bila kita ada makan-makan raya, my God, everything is, I think my household pun, my family household pun, masa raya je I can see an array of desserts.
And they say sugar is addictive. So sekali kita dah biasa makan dengan sebegitu, it becomes a lifestyle,
Yes, that's
a daily lifestyle. So Prof, besides from what we've already covered, what kind of other advice or plans would you recommend to help obesity among kids?
Okay. Yang paling penting kan actually to combat obesity ni is not just from one parent atau mak dia je yang kena buat atau bapak dia je yang kena buat atau carer je kena buat. It's actually the whole family. The main culprit sometimes can be grandparents.
Bagi je apa dia nak.
Yes, exactly, sayang.
Nak sweets, bagi. Nak cupcakes, nak lagi cupcake, nak chocolate ice cream.
Exactly. So my case today that I had, I think he is at the moment, kejap I can't remember, he's about 8 and 9 Dia makan, actually 8 and 5 years old. He actually ate nearly 7 times a day.
7 meals.
7 meals a day.
Wow.
So sebelum pergi sekolah, masa sekolah, lunch, recess dekat kafa pun continue to makan. Balik on dalam kereta sebelum dinner dah bagi another waffle.
How do you get
lah,
such a
whatever.
big appetite at that age, that tender age of 5?
I think it's that one's about 6 lah, going towards sekolah kan, macam darjah 1 macam tu. I think it's mainly behavioral. You allow that to happen. Tak apalah, lapar nangis, kau makan je lah, mama nak drive ni, please be quiet. I give you now waffle, you keep be quiet at the back, that kind of thing. So when you allow that to happen, in long run dia tahu nak manipulate you. They know how to ask for more food. I cry, you give me food.
So it becomes a habit.
It becomes a habit. So it becomes a vicious cycle. So you need to kena pasti, macam I was saying just to my other colleague just now, parents need to know where to stop, when to say no. And it's okay for you to say no and discipline your child.
We have a very exciting segment. It's called Myth or Fact. So of course we have some statements, some things to throw out to you.
Okay, fantastic.
And we want to know whether it's a myth or it's true.
Okay.
So everyone that's tuning in, you can play along. Perhaps diorang ni pun mungkin dah tersangkut dengan tak tahu ni betul ke tak betul ke, ni cerita nenek moyang ke kan. Alright. So the first one, Prof. Sugar can cause cancer?
Okay, so I'm sure kalau you type, I'm sure there's a lot of parents type, even kita pun sometimes types bila kita dengar
on Google
Google tu on Google kita dengar atau kita cari sugar can sugar cause cancer atau tidak kan. So actually there's no direct link. If you look at studies and everything else, there's no directly sugar menyebabkan cancer, tak ada. Okay, but sugar is a source of a lot of problem. Okay, antaranya obesity, we just talked about that. Diabetes definitely. Okay, and of course sugar can feed a lot of issues internally. So of course not direct link, but bear in mind, sugar is the problem to all of the metabolic diseases.
I think in general, experts have never really found a direct causation to cancer anyway. But sugar is still a big problem. We already have 1001 problems in our lives. Kita tak nak tambah lagi masalah kehidupan ni. Okay, thank you so much. Thank you so much, Prof, for that. Another one, I don't take drinks with sugar. And I don't take sugar at all during meals.
Yes.
But why is my blood sugar still high after eating? Is this possible?
Right. Okay, I've got that a lot from my teenage boys, girls and boys who are already dah diabetes. Okay, they start off with obesity and then they develop diabetes. And dia kata, doktor, saya tak makan pun. Gula ni mana ada tambah-tambah gula dalam teh?
Betul ke? Kita perasan
I trust them. They don't tambah.
Okay.
But they forgot the most important bits is that sugar does not come in bentuk gula. Sahaja. Okay. Like you say, in birthday cakes, where are the sugars? Okay, icing to sugar lah. But the flour itself, kita tambah gula, betul? Okay, so it's a hidden sugar.
Yep.
Apart from that, nasi itself is sugar. Nasi, kita masak nasi, kita tak tambah gula pun.
Okay.
Kan?
Okay.
But nasi itself is carbohydrate. Carbohydrate is the source of raw sugar. So once kita makan nasi, it becomes sugar. So kalau tak tambah pun, memang sugar lah. Memang tak boleh elak. Unfortunately, in Malaysia, our food is all about sugar. So paling senang sekali kita pergi breakfast lah. Kita cari breakfast ni. I pun lapar nak pergi kerja ni. Tak sempat buat breakfast kat rumah. Of course, the best breakfast is like avocado lah. You know, the merepek-repek lah, whatsoever not. Tapi actually that's not even, apa kita panggil, logic lah kot. Macam it's so non-convenient. The convenient ones apa? Nasi lemak. Tepi jalan ya. Roti canai, nasi lemak, kari puff, apa nona manis, lagi seri muka.
Janganlah buat saya lapar. But yes, you're right.
Semua tu gula.
Okay, but whether sugar yang kita ambil tu, yang kita consume, whether it's sugar yang putih tu, you know, or whether it's sugar yang hidden dalam nasi, does it affect the severity of
Yes.
the health conditions that can cause to us?
Okay.
Does it differ?
Okay. So kalau pesakit tu dah diabetes kan, dia kita galakkan dia untuk monitor sugar. Alright. So the easiest way to understand this food is actually to wear CGM kita panggil. Nanti we can talk
CGM.
about it. CGM is continuous glucose monitoring. Okay. So non-diabetic also macam contoh macam saya atau any one of you yang dah rasa macam obese and pre-diabetes tu, baguslah pakai CGM ni. Okay. So CGM ni I put on children as well so that they understand what they eat. Dia macam device yang dia lekat dekat belakang tangan ni.
Okay.
And then dia akan track kita punya sugar. So I've done it before and I can see kalau I makan nasi, it will go up. Alright. Kalau makan roti, it go up even faster.
I see.
Obviously, kalau I makan all the sweet things, lagi cepat lah. So, it depends on what type of carbohydrate. So, kalau you makan pizza, so pizza, dia ada carbohydrate, tapi there's a lot of fat also on top. Cheese and, you know, things like that. So, dia tak naik macam ni. Dia akan naik slower, tapi lama. My God, dia punya gula tak nak turun-turun. So, yeah, sometimes
Prof dah senaraikan all this food. I think a lot of us yang watching dah rasa guilty. Not just us but our offspring, our children. We let them eat all these things. Kan?
Sebab kita tak nampak tau. So that's why bila you pakai the CGM, you nampak, then you will know, I should not take this much.
Yeah. So that can help us at least track what we
and understand
take.
what food that we can eat or what we cannot eat.
Okay.
And to be honest, your sugar and my sugar probably different. You makan nasi lemak, sugar you probably naik lagi cepat compared to me. You know, it differs from person to person. So the only way to know is by checking, of course.
Okay, tadi I ada sebut Prof, sugar rush. Selalu parents kata, oh please don't give my kids ice cream just before the bedtime. Nanti ada sugar rush, tak boleh nak tidur pula esok sekolah. So, can sugar make children hyperactive?
Yes, there's a lot of talks even among children with autism, kan? Children with hyperactive attention deficit, talking about sugar and their behavioural. I mean, we know sugar causes spikes of energy. You bagi makan sugar, of course your energy spikes, but it probably depends on what you take. Like I said just now, it can be sustained longer or sekejap je. Okay, so of course it is unhealthy to give your child ice cream sebelum tidur. But you know what, I've got lots of children out there makan roti canai pukul 10:30 malam.
Kenapa
Sebab tunggu bapak balik.
Again, lifestyle choices.
Pergi malls, beli ice cream kan, jalan-jalan dengan mall dengan parents pukul 9-10 malam. Selagi kedai tak tutup, selagi tu kita dekat mall.
Yelah, in this day and age, Prof, ada macam-macam available, all kinds and of food, and they all look so interesting, so tempting. Macam nak resist.
Betul.
Itu pun satu masalah
kan. There goes in discipline.
Okay, the next one. I think this one discipline. Terus nak divert.
Stress. Okay.
This one, fast and easy. Okay. Sugar causes diabetes.
Like yes, definitely. So
Definitely,
if
kan?
you don't take sugar properly, you take too much sugar, there you go lah.
Prof, saya sedih dengar tadi ada yang umur 5 tahun, 8 tahun, 9 tahun and already having medical
Some
issues,
problems.
right? But can children actually outgrow obesity?
Okay. Ramai parents rasa macam tu. Tak apalah, dah besar nanti kuruslah dia. Betul. A lot, especially grandparents, memang akan cakap, it's okay, tak apa, kita bagi je dia makan, nanti dah besar tu dia outgrow lah. So I think the most important thing that we need to understand is you keep on believing on that myth, gone case. Okay, maksudnya it is not a myth anymore. So if you it's not myth anymore, it is a myth. They will not outgrow. It is a myth. So maksudnya there's a lot of studies yang dah buat so many years. Obese children, kalau you don't do anything, 80% of them will be obese adult.
Okay.
So you need to do something about
So when you say outgrow here, outgrow maksudnya the
Kurus
parents
lah. Jadi
tak
kurus.
buat apa-apa, tak memberikan apa-apa treatment or medication,
Atau
thinking that it will
change
just
of lifestyle,
hilang.
they will just hilang.
That's not true. It will never happen like that.
Nope.
And last but not least, Prof, obesity is a sign of prosperity.
Correct.
Obesity ni menandakan dia macam penyakit gout, Prof. Dulu kalau zaman-zaman dulu kala kan, kalau ada penyakit gout tu kan orang panggil Kingsman,
Ya ke?
King's disease. Sebab dulu waktu dulu zaman dululah hanya yang raja-raja je yang dapat penyakit gout. Sebab mereka sangat mewah, ada duit,
Yes.
boleh beli macam-macam makanan.
Yes.
Orang biasa tak dapat
beli.
gout.
Yes, correct.
Sekarang ni semua dapat gout kan.
Correct.
Tapi kalau obesity ni pula, is it a sign of prosperity?
Yes. So I suppose I think in some of our ethnicity assumes or treat children who are obese actually prosperous. Sebab hanya anak-anak orang kaya zaman dulu
Yeah.
anak-anak orang kaya je yang gemuk. So the grandparent punya idea is if my child gemuk, orang akan pada dia ni bagus ni, dapat makanan
Sihat,
bagus.
dia punya selera dia bagus.
Sihat.
Anak
Parents
I-
kaya.
Anak I nak makan pun susah. Anak you nak makan, bagi je dia
Je,
makan. Pernah dengar tak statement tu?
Yes, correct. So unfortunately people are thinking that way. So please don't put it that way. If you continue to feed your obese child, you are literally pushing him into the grave earlier.
Thank you.
As sharp as that.
Yeah.
I'm sorry.
Thank you, Prof, for debunking the statements. Yang ada yang true, ada yang not true. So please, kepada yang mendengar ni, ni lah, take heed. Dengarkan dan juga hadamkan.
Yes, that's right.
Did you enjoy today's Curated episode? Well, don't forget to tune in for the next episode of Curated podcast by UMSC. To learn more about our consultants, specialties, or to book an appointment, visit umsc.my. For health tips, behind-the-scenes content, and expert insights, follow UMSC on Instagram, Facebook, TikTok, Spotify, and Apple Podcasts. Till next time!